Video 3, Treating Others with Reiki. Now that you've learned to treat yourself using Reiki, we will proceed with the techniques that will enable you to treat others with Reiki. However, before you begin, take into account the necessary considerations: environment, jewelry, tight clothing, alcohol, and personal hygiene that we've already covered in the Pure Reiki Healing Manual. There's one other important consideration that you'll need to remember, one that we'll go through right now as a bit of a reminder for everyone, and that is the invocation. To recap what you've learned from the manual, it is important to remember that as a Reiki practitioner, you are not healing your clients. The people receiving Reiki are in fact healing themselves. You are merely the channel that enables them to draw the Reiki energy through your hands to the place that is needed. The invocation is a token that symbolizes you are giving up any claims to power. You are simply the conduit in which the infinite power of the universal life force flows. Although the invocation is not necessary to turn on the Reiki energy, I feel it enables the therapist to disassociate themselves from their ego and pay respect to the universal life force and the person they are about to work with. Your prayer should be personal and in line with your own beliefs. Ask for permission to be used as a channel for Reiki healing. Take a few moments before you begin treatment to reflect and focus your thoughts on healing. Mentally prepare yourself as a channel for Reiki. It's important for you to begin any Reiki treatment with the right mental attitude. Your wish should be to pass on unconditional love and healing in the purest form and sense. Once your client is lying down on the healing table, relaxed and ready to receive Reiki, move to the top of the table, the client's head. Close your eyes and join your hands together in a prayer-like position in front of your heart chakra. Alternatively, if your client is seated, place your hands on their shoulders for the invocation. Now here's an example for a personal invocation that may help you develop a prayer that is suitable for your own use. I call upon Reiki, the universal life force, all the angelic beings who have worked with Reiki in the past, especially Dr. Usui, Dr. Hayashi, Madam Takata, my guides, and all the Reiki masters past, present, and future, to draw near and take part in this healing session. I ask that the power and wisdom of Reiki permits me to become a channel for Reiki's unconditional love and healing on behalf of, insert client's name. May Reiki's infinite wisdom go exactly where it is needed most. Should it be for their higher good, may we all be empowered by your divine love and blessing. Amen. Before you begin treatment, run your hands in your client's aura about 6 inches above their body, from their head right down to their feet, in a slow, smooth motion, at least 3 times, to remove any superficial energy buildups. This will also bring harmony to your client's aura and form a positive rapport between you and your client. Pay attention to your hands, use your intuition, sense for possible blockages or hot spots to focus on during your healing session. A few things to note before you begin a full-body treatment on another person. Never give a Reiki treatment to a person who has a pacemaker, as Reiki can alter its rhythm. Never give Reiki treatment to a person who suffers from diabetes mellitus and are taking insulin injections, unless they are prepared to check their insulin levels every day, as Reiki reduces the amount of insulin they require. I always explain to a person who is visiting you for the first time for a Reiki treatment exactly what you're going to do and the type of reactions that might occur. Stress that any one of these reactions are normal. They may experience 1 or 2 of these reactions, all of them, or none of them. It makes no difference. Reiki will go wherever it is needed. Note that your clients might experience a sense of heat, a sensation of cold, seeing colors, past life flashes, involuntary movements, sleep, itchiness, emotional responses, rumbling stomach, memory flashes, pins and needles, sensing your hands moving. Often the client will experience extreme cold at the position of your hands while you feel intense heat. If the client experiences nothing, explain to them that the Reiki energy often works on a subtle level, yet has profound results which normally become apparent in the following days or weeks. Never forget that the client is drawing Reiki through you. They are doing the healing on a subconscious level. You are only the channel. Reiki always travels to the place it is needed most. No knowledge of the human anatomy or physiology is required to work with Reiki. Leave your ego aside, and Reiki will do the work. Forget the symptoms. Treat the whole person. Listen to your client's body through your hands. Sense the different types of energy. If the energy is strong, keep your hands in that position until you sense a shift in the energy level. Use your intuition. Look for nonverbal communication from your client's body. Deep sighs or hand and leg movements are good indicators that something positive is taking place. The normal time required for a full body treatment is between 60 to 90 minutes. At the end of a treatment, always offer your client a glass of cold water to aid grounding. Always wash your hands under cold running water after each treatment. You are now ready to begin the treatment. Ensure your client is lying flat on the therapy table with their arms down by their sides. Their legs should also be flat against the table and must not be crossed, as this may block the flow of Reiki. Gently lay your hands on the client's body. Keep them in position for between 3 to 5 minutes. As you become more experienced, use your intuition. Your hands should be cupped with your fingers firmly closed as though you were trying to hold water. This keeps the channel strong between your client and the universal life force. If your fingers are open, Reiki can escape just as water would slip through your open fingers. In the case of burnt skin or a client's genitals and breasts, hold your hands just above their body. Now remember, the following hand positions are only a guide. Use your intuition when treating your client. For the first position, place your hands together with the sides of your thumbs touching, your palms facing downwards, positioned a few centimeters above your client's face. Now slowly lower your hands onto the face, like so. Your thumbs are to be placed in the middle of the forehead and slightly over the top of the bridge of the nose. Your palms should rest over the eyes, with your fingers resting lightly on the cheeks. Hold this position for 3 minutes as you focus on channeling Reiki to your client. This position is ideal for the relief of issues relating to stress, eye problems, asthma, head colds, allergies, sinuses, pituitary gland, pineal gland, and cerebral nerves. The next position is used to treat issues such as migraines, headaches, eye problems, multiple sclerosis, stress, bladder, digestive disorders, flatulence, and emotional problems. Place your hands on top of your client's head with your palms covering the crown chakra, like so. Use your intuition to hold the position for as long as you feel necessary as you channel Reiki to your client. For the third position, place the heel of your palms above each of your client's temples, your fingers laying against the side of the face, like so. Now these next set of movements take some practice in order for you to maneuver your hands gracefully into the following positions. Slide your right hand from over your client's ear onto the side of their cheek. Next, place your left hand on the left side of your client's face and slowly push the head over to the right so that the back of your right hand is now touching the table. Now place your left hand under the back of your client's head with your fingers pointing down and over part of the neck. Gently roll your client's head to the left so that the back of your left hand is now touching the table. These positions are especially useful for balance, tinnitus, hearing, and ear problems, colds, and flu. It also helps balance the functions of the right and left hemispheres of the brain. This next position helps alleviate headaches, eye problems, stress, hay fever, sinuses, digestive disorders, fears, phobias, shock, depression, and stroke. Gently cradle the back of your client's head and the top of their neck with both hands covering their occipital ridge, like so. Make sure your hands are comfortable and that your client's head is secure and balanced as you channel Reiki to your client. Then, slowly, gently roll your client's head, first to the left, then to the right, like so. Now this next position will help your client with issues relating to self-expression, communication, breathing, voice and speech problems, bronchitis, flu, colds, and anger. Before you proceed with this particular position, however, do note that some people may not necessarily be comfortable with having another person's hands too close to their throat, so be sure to take that into consideration. Place your hands along your client's jawbones, covering the throat, with your fingers and thumbs touching, like so. Channel Reiki to this particular area, again using your intuition to determine how long you should hold that position. This next position helps with aches and pains in the arms, elbows, and hands. It also helps loosen tight shoulder muscles, relieve stress, cold hands, and disrupted blood supply to the arms and neck. Simply place your hands on your client's shoulders, like so. Remember to use your intuition to determine how long you should channel your Reiki to this particular area. Now, these next set of positions is best for the treatment of all major organs and glands, disease, infections, stomach, intestines, reproductive system, anger, stress, emotions, leg pains, and varicose veins. Start by forming a T with your hands, covering the heart chakra and collarbone, like so. Next, move your hands down and across the torso, covering the solar plexus and sacral chakras. Your hands should be placed one behind the other, beneath the chest area. If your client is a woman, place your hands just below the breasts, starting from across the ribs, then down the torso, like so. Hold the position for 3 minutes as you focus on channeling Reiki to this particular area. Now place your left hand on the inner side of the client's right hip bone, with your fingers together and pointing down toward the pubic bone. Place the heel of your right hand a small distance from your left fingertips, with your hand pointing upwards on the inner side of the left hip bone. Your hands should now be in the shape of a V, like so. Alternatively, if you have a male client, instead of placing your hands in a V shape across the pelvic area, you can place your hands on or just inside each hip bone. Simply place one hand with your fingers facing straight up, and place the other hand with your fingers facing down, like so. This way, you can avoid any potentially embarrassing situations. Now, move your hands down to your client's knees slowly, channeling Reiki from the pelvic region to the knees, one hand at a time, like so. Hold this position for 3 minutes. From the knees, move your hands down your client's legs to the feet. For your own convenience, you could move to stand at the bottom of the table. With your hands resting on your client's ankles and feet, hold them with your hands pointing upwards. Now ask your client to turn over on their stomach. Do note that by now your client is probably relaxed, so tell them to turn over slowly. If your client is asleep, wake them gently. You can have your client rest their hands by their sides, but some may prefer to rest their head on their arms. This is fine, but do be aware that this might make the next position difficult for you, since their muscles will be scrunched up. You may want to suggest to your client that they keep their hands by their sides just for the duration of the next position. Begin by placing your hands on your client's shoulder blades, like so. Keep in mind that for most people, the shoulders hold a considerable amount of tension, so you may feel hesitant to move your hands from the shoulders as you channel Reiki to this particular area. This may happen at any given time during the treatment, and it's best that you remain in the position until your hands feel ready to move on, once you've channeled the necessary amount of energy to the shoulders. Now move your hands slowly, down from the shoulders, to the back of the heart area, and hold for 3 minutes, like so. Note that this area of the body may require some extra attention, so it's okay for you to spend more time here if necessary, especially since you're also treating the lungs, which are an integral part of the entire cardiovascular system. At this point, your client may experience an emotional response of some kind as you channel your Reiki around their heart area. Some may mention this to you, while in some circumstances, only you may feel such sensations. Once you feel ready, move your hands down slowly to the adrenals and kidneys, like so. Place your hands over your client's adrenals. Then slowly move your hands down again to cover their kidneys. If your client is experiencing back pain around the tail end of the spine, Move your hands down until you've covered the whole area. Also, if your client is male, you can treat the prostate gland by positioning your hands into a T shape, like so. Next, you'll want to move your hands down the length of your client's legs, down from the knees to the feet. This particular position helps ground your client. Alternatively, you can place one hand at the top of your client's leg closest to you, then place your other hand flat against the sole of their foot, holding this position for 3 minutes. Now move to the other side of the table and treat the other leg. Be sure to hold on to your client's feet while you do so, as it isn't ideal to break contact. The positions you just learned will help treat issues relating to all major organs and glands, disease, infections, stomach, intestines, back, and spinal problems, reproductive system, anger, stress, emotions, leg pains, and varicose veins. For all major organs and glands, it is recommended that you treat them through the reflexology points on the feet. Finally, when all of the positions have been treated, place your left hand on your client's crown chakra, your right hand at the base of their spine. This final position balances the energy in your client's body. Complete your treatment by combing your client's aura. Stroke the body firmly from the crown down to the feet in a sweeping motion. Continue past the feet until you touch the floor for grounding. Repeat for a second time, lightly touching the body. Finally, comb the aura a few inches above the body.